first position is an athletic stance, which exercises calves, gluteus maximus, and hamstrings. The knees are bent, pressure is applied to the calf muscle, which is the gastrocnemius and soleus muscles. The gastrocnemius origin is the femur medial head, above the medial femoral condyle, lateral head, and above the femoral condyle. Insertion is dorsum of the calcaneus via the calcaneal tendon. Action is to flex the leg and plantar flexion of the foot. Phalanges are flexed, gripping the racket, and the wrist is inverted. The muscles in the neck, such as the sternocleidomastoid and trapezius, is relaxed. The origin of the sternocleidomastoid is the sternal head, anterior surface of the manubrium, clavicular head, medial 1/3 of the clavicle. The insertion is the mastoid process and lateral 1/2 of the superior nuchal line. The action draws the mastoid process down toward the same side, which causes the chin to turn up.
The model then laterally rotates her body as her left hand lets go of the racket, and the phalanges on the right hand remain flexed, gripping the racket. She laterally rotates her shoulder joint, exercising the rotator cuff, bringing it back, and continues in the squatting position. The wrist is flexed backwards and the knees come to a low stoop. The head is resting still on the atlas turning. Then the right hip is also an abduction as the right knee is slightly flexed, still as the right arm moves upward in an upwards extension. The right hip is in slight abduction as it laterally rotates. In the right arm, the biceps, pronator teres, and the brachioradialis are being used. The biceps are inserted in the radial tuberosity and the bicipital aponeurosis to the fascia on the middle side of the forearm. The pronator teres origin is at the humeral head, which is located near the medial epicondyle of humerus and distal supracondylar ridge, and the ulnar head, which is on the medial side of the coronoid process of the ulna. The brachioradialis action is flexing the forearm at elbow and stabilizes the elbow during flexion and extension. In the left arm, the triceps brachii is being used. The wrist is supinated as it comes in contact with the ball.
The arm then adducts across the pectoralis major. The wrist pronates through the follow-through. The origin of the pectoralis major is medial 1/2 of the clavicle, manubrium and body of sternum, costal cartilages of ribs 2 through 6. It inserts at the crest of the greater tubercle of the humerus. The action is to flex and adduct the arm and to medially rotate the arm. The arm then finishes the swing with the racket touching the subscapularis. The subscapularis is medial 2/3 of the costal surface of the scapula. It inserts at the lesser tubercle of the humerus. Medially rotates the arm and assists in extension. The trapezius is flexed while in this position. The origin of the trapezius is medial 1/3 of the superior nuchal line, external occipital protuberance. Inserts at the lateral 1/3 of the upper crest of the scapular spine. The action is to elevate and depress the scapula and rotate the scapula superiorly.